morning, folks. Thank you for showing up, even after last night. I was talking to Dr. Wooten last night, and she was like, you'll be able to tell who stayed out late tomorrow morning when we all show up. But then I'm sure, like, for example, like Dr. Schaefer could probably have been up until 7 a.m. and then show up, you know, looking put together, because I don't think she sleeps. But good morning. I'm going to start, unfortunately, this morning with a little bit of a bittersweet note. This is 2 PCC staff members' last UC with us. Yeah, and unfortunately, they are heavy hitters. So we are we are sad to say goodbye to 2 folks who are retiring this year. Good for them. The first one is Mark Johnson from our sales team. Yeah, give it up for Mark. I mean, come on. And the other person retiring is Sue Clark from our QA team. So if you see either of them today, make sure to give them an extra hug. I mean, Maria retired years ago. She still comes to the UC, so who knows? Maybe you'll see him in the future. So just a couple things. New this afternoon, we are doing Ask Chip Hot Ones, PCC Hot Ones. We've recruited a couple people who are particularly not tolerant of spicy foods, who are also experts in certain fields. And Chip is going to be asking them questions while they eat hot wings. So yeah, it's going to be Hot Ones style. It should be really, really fun. Justin in particular is a little nervous, I think, because he doesn't do well with spicy foods. So if you want to come watch those PCCers make an absolute fool of themselves, but also answer all of your incredible questions, stop by this afternoon for PCC Hot Ones. Wow, all the acronyms. Also, another thing that's new and big this year is we have a really great prize for our UC General Survey. I don't know if you guys have heard about this, but if you complete the UC General Survey on the app, you could win a paid trip to PMI. So we will cover your hotel and conference admissions. Oh my gosh, whoa, it's a generous gift from Polly at PMI. Wow, okay. So if you go to PMI every year, or if you've wanted to go to PMI, you could possibly win admission and hotel there for free if you fill out the survey. That's how desperate we are to hear back from you guys. We want to know what we're doing well, and we want to know what we're doing not so well. I just wanted to say that last night, for those of you who were at the Big Bash, I was wearing these shoes that were really tall, very painful. Everybody got angry when I took them off. I brought one. Here it is. This is the shoe. I've got something else behind my back, as you can tell. So this was the shoe, right? And everybody was like, oh, why did you take it off? Oh, why did you take those out after only an hour? Literally anyone who can fit into a women's size 12, try wearing these for an hour, and then you'll have my back. So I actually ordered another pair of shoes. They're gorgeous. However, I don't know if you noticed. Surprise! I'm trying to. No! Don't look! I did the one thing I'm not supposed to do. Everybody, look back here. Look back here. This one's a woman size 5. Point is, I'd never fit into it, okay? We get it. I just screwed up royally, and that's totally fine. Okay. So, we've been planting clues all week at what next year's theme is. There's one really big clue in the room right now. One really big clue. No, it's not Sesame Street. I wish it was, though. We got to write that one down. No, but I don't know if you guys knew this. I'm about to announce next year's conference and theme. I know. You're blown away. You had no clue. You didn't even know we have a video going to come up. Next year, PCC and industry experts are going to present talks and workshops to help you guys pull the weeds out of your workflows, right? We're going to reap the benefits of new software features and nourish the roots of your practice. Oh, that's so sweet. That's so much nicer than I would have said. Thank you, Aaron, for writing this for me. You can cultivate your friendships with other PCC practices and maybe sprout some new ones. The garden of ideas and good times awaits for you at PCC 2026. Right, the clue was me. No, it's so wild to say genuinely, guys, with no lies. I had this already, and then I found out the theme a couple days ago, and I was so ecstatic that I already had this. So if you want to scan the QR code, or I believe it's available in the app probably to register for next year yet. We have saved the date cards. That's so cute. It's like we're getting married. But yeah, you can officially register for next year. For those of you who don't know, last year we started doing this just because we know it's really tough to make sure that you have time off, staffing, and everything for the next year. So we have our dates, everything available. You can register right now, or you can register this afternoon if you don't want to overload the Wi-Fi here. I know our IT folks wouldn't mind that, but register as soon as you'd like. We're super, super excited to have you guys here next year. I will probably wear this. Okay. So now it's my absolute delight. We're going to have a little bit of fun this morning. We have this rule of thumb at PCC that if you do anything at all, ever, at the office, you are subject to Aaron asking you to do that in front of hundreds of people at the UC. And so one day we had this fun idea to host Family Feud, or as Chip would call it, Family Food. So food-oriented, that one. It was really, really fun. Ours was like 3 hours long. So we're not going to do that. We're going to do a nice little quick one. But we did get some volunteers yesterday, and I am so excited to bring those folks up. The first team is Yoisha and Sandra from Eastern Pediatrics in North Carolina. Come on up. So they are our first team. And then our other team are Kayla and Dr. Patel from Kidology in Michigan. And I'm going to change really quickly into something more casual. So pick your side, take your seat. Welcome to Family Feud. How's everybody doing today? I know this is a little bit more showgirl than it is Family Feud, but look at those legs. He works out. Okay. Welcome to the UC edition of Family Feud, PCC. Okay, so we sent out a survey to, gosh, who knows how many of our clients, all of them, and we got about, how many responses, Aaron? 60-something, 70-something responses? Next time, you guys, you got to respond, because this is important stuff. But, so we're going to play traditional Family Feud style, where I am going to read the question, and yeah, we don't really have a buzzer. So, but what we did, because we didn't have a buzzer last time, was that I'm going to do a pick a number thing to see who goes first. If you get that answer correct, you can take that category, or you can pass it to the other team. Opportunity to steal at the end. If anybody needs a review of the Family Feud rules, let me know. Otherwise, we're going to kick it off. Yeah? You got it. You got this, Dr. Patel. All right. So our first question, I'm going to do, pick a number, Caleb, between 1 and 3. Okay, that was the number. So there's no chance you guys were going to get that. All right. So we asked a bunch of people responded. What's your favorite Ben & Jerry's ice cream flavor?
Is this us as a team or me as a team?
Well, this is whoever responded. So you're trying to answer for all of the folks that responded to this question. Chubby Hubby. Not Chubby Bubby, it's Chubby Hubby. But let's see, Chubby Hubby, is that on the board, Jen? No, it's not on the board. Okay, so we are going to pass the board over to Eastern Pediatrics. What's your first answer? Half-baked. Jen Mar, can I see half-baked? Ding, 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 it's the number 5 answer. All right, Yoisha? Chunky Monkey. Do I see Chunky Monkey on the board, Jen? Yeah, Chunky Monkey is the number 3 answer. You guys are on a roll. All right, let me hear another one.
Butter pecan.
Butter pecan. Let's see if butter pecan, do I see that on the board, Jen? Oh. Okay, so you get one more wrong answer, and then we'll pass it on to the others. Cherry Garcia. Do I see Cherry Garcia on the board? Number 2 answer. All right, let's see. So we're still missing the number 4 answer and the number 1 answer. And remember, these aren't necessarily the top ones in the world. These are the top ones from PCCers. Strawberry cheesecake. Do I hear strawberry cheesecake, Jen? Oh, okay. So, if you guys are able to give me one of the answers on the board, you can steal. Otherwise, points go to Eastern Pediatrics. The Tonight Dough. That was Stephen Colbert, right? I think it's Stephen Colbert's flavor. Do I hear Jimmy Fallon? He has another one, Americone Dream. That's Stephen Colbert. See, look, I know my ice cream. Jen, is Tonight Dough on the board? No, it is not. Okay, so Eastern Pediatrics takes that round with 42 points. Okay, so that was sort of our... Oh, the other answer. Sorry, the number 1 answer was fish food. And the number 4 answer was New York Super Fudge Chunk. And I know that that's the one that you was trying to figure out. All right, next round, we are going to slide a little bit further into the actual PCC realm of things. So now we're going to test your knowledge of the EHR. Name your favorite PCC feature. I'm going to start over here because you guys had the opportunity last time. Let's see.
Auto posting.
Auto posting. Is auto posting on the board? Jen? It is not. People don't like easily posting insurance payments, I guess. Darn, you would have thought. I guess they like it really difficult. Or maybe just billers didn't answer. All right, so they don't get to answer this. Now it's your turn. All right, give me an answer. What's your favorite? Ooh, portal self-scheduling. Let's see, is that on the board, Jen? It is the number 2 answer. Okay. All right, give me another one. Pre-check-in. Ooh, that's a new one. That's a risky guess. Jen, pre-check-in? Yeah. Self-scheduling and pre-check-in are different things, for those of you who are wondering. Yeah. Somebody was like, well, patient check-in. And I was like, that's already on the board. Let's see. Oh, yeah, you guys get more wrong answers. Go for it. Let's hear it. Aw. Yeah, you do got this. Well, what's your favorite thing? Retrieving M's? Yeah, retrieving M's. Is that on the board, Jen? No, it's not. Yeah. No, chip is not a feature of PCC. Chip is a flaw of PCC. All right, you guys got one more wrong answer. As he walks into the room wearing his... You can tell who likes to dress up and who likes to wear band t-shirts. Oh, he was just playing tennis. I apologize. That's super, super valid. Ooh, PCC support. That is on the board. It is the number 6 answer of customer service. All right, yeah, you guys are still in the game. Name your favorite PCC feature. We asked a bunch of PCCers. Form configuration. Do I hear it, Jen? Oh. Yeah, you see, you got to understand, you need to say the things I think that people actually enjoy doing. While forms configuration is a great feature, it's not very fun to do forms. All right. This is your chance to steal. Snap text. You're going to go with snap text. All right, let's see if snap text is on the board. It is. Which means that Eastern Pediatrics has just stolen. Nice. Oh, Jen's showing the other ones. Number 5 was prescribe in Pocket PCC. Number 3 was chat. And number 1, favorite feature, was the patient portal. All right, so I'm going to be honest with you guys. You got some ground to make up, but I feel like you could probably do it. So now the first chance this time is going to go over to Eastern Pediatrics because... Oh, no, it's you guys again. Yay, it's you guys again. Sorry, I'm rooting for them because they're losing. Not because I like anybody more or less. All right, so the next question, there's only 3 answers. Okay. So you guys could sweep this one, depending. I don't know, Eastern Pediatrics might take it. We'll see. Name a former city other than Burlington in which the UC was held. Their answer is Denver. Jen, is Denver on the board? It is. It is the number 1 answer. And now I know that you're struggling. I was about to say, I feel like the history with PCC here is a little different. But let's see. You got the number 1 answer already. You have, yeah. There's 2 more. San Diego. I know they've only been live a year. And I know that Eastern Pediatrics has been alive for like 10 years. No, San Diego is not on there. All right. Another big city. Come on. No help from the audience. Anaheim? All right, let's see. Is Anaheim on the board? Jen? It's not. I will say, no hints, but you have the right idea, I think.
San Francisco.
San Francisco. Is San Francisco on the board? It is. It's the number 3 answer, okay? They are just like throwing darts. Orlando is your last answer? All right. Is Orlando on the board, Jen? It is. Through sheer luck and a hint of intelligence, Dr. Patel and Kayla got it. All right, so you guys take that, and that was 81 points. So it's right. Currently, the score right now is 94 points for Eastern Pediatrics. Oh, is it the other way around? Wow. Okay, so 94 points for you guys, 81 points for you guys. I'm no longer rooting for you. All right, next question we've got. If your practice, this one's a little bit of a heady one, sorry. If your practice was a toolkit, name the tool that you would be. Okay, there's 5 answers. Remember, PCCers, clients, not staff, clients answered this. Okay, Eastern, you get the first guess. If your practice was a toolkit, what tool would you be? A hammer? I feel like that's a fairly safe bet. Do I see hammer? I do. It is the number 1 answer. So do you guys want to take this round or you want to give it to them? Great. They're going to try it. All right, here we go. If your practice was a toolkit, what tool would you be? Screwdriver? Let's see. Is screwdriver on the board? Yes, it is. You have to understand also, folks, that there's probably a good handful of people in here that those are the only tools they know. What would I be? A hammer, you know? And I get it. Some people are like, oh, yeah, I'm hammering on insurance companies or whatever. But, yeah, that's good. All right, you guys have another answer for me? Ooh, a measuring tape or a tape measure. Is that on the board, Jen? It is. Oh, my goodness. You're in trouble. All right. I know. You should just say, what are other tools? Yeah. Believe it or not, I own just about every tool known to mankind, and I love carpentry. You wouldn't think with my, flamboyant outfits, but I can do some woodworking, and I can do some carpentry. It's pretty impressive, actually. I've built a lot of things. All right, let's hear. Thank you. Let's hear. A wrench? A wrench. Do we have a wrench? Oh, okay. All right, you got 2 more wrong answers that you can give me. If your practice was a toolkit, name the tool you would be. Look, these 2 just got it by guessing random cities, so I bet you guys could just come up with a couple more tools and sweep the category. Yeah. That's not a tool. You just said a nut. Imagine you're going to go fix something and somebody's like, here's your toolkit, and it's just a nut, maybe a bolt. You guys can't come up with any tools? I'm not really allowed to condone audience participation, but you guys said a saw? Yeah. Oh, Sandra said a skill saw. That's it. Yeah, I like that. A saw, Jen. Oh my gosh. Wow. A ladder? I am really loose on what a tool is here. That's a screwdriver. You should said a flathead. That's a screwdriver. Oh no, good Jen. Oh no, we'll count it because otherwise we'd be here all day. Yeah. All right, y'all, you have an opportunity to steal. There's 2 more answers on the board. We've already heard hammer. We've already heard screwdriver. We've already heard tape measure. And Nut, ladder, those don't count. Flathead, that doesn't count. Come on. Hold on. Okay, you should pick one of them. Pliers. The reason I told you to pick one of them is both of them are wrong. Pliers on the board. Oh, there's not pliers on the board. All right, so that means Eastern Pediatrics is going to get those points. And the remaining answers were a toolbox, yeah, and a multi-tool. I know, but like a Swiss Army knife. Well, when you think about it, both pretty good answers, right? Because there is some OM out there that's like, oh, I hold all the tools together in one place. And then there is one, doc out there who is the only provider at their practice and the biller and the front desk person. And they're like, oh, I am a Swiss Army knife. I can do all the jobs. So we're going to move on to our next question. And this one, you guys get to answer first, if you'd like. And it is name one recommendation that Chip has for improving your practice. Oh my gosh. Well, own your brand. Jen, is own your brand on there? It is not. Okay, so I will say you have to remember that these aren't necessarily correct. These are what people think Chip says when he's talking. And I think Chip, seeing these answers will probably be very useful for you because you can see what people are actually picking up on. Yeah. Own your brand. So, yeah, next time we send out a survey, own your brand, guys. There are 5 answers on the board. Google yourself? Yeah, I do that like 3 or 4 times a day. Google yourself, Jen. Is that on the board? Oh, it is not. Ooh, I know. This is a tricky category. I feel like that might actually be not helpful. Because you're going to get a bunch of people just shouting what they think. But I mean, maybe. Everybody shout what you think Chip would tell you to do. Yeah, that was super good and helpful. That was awesome, guys. You really did it all together. G2211s? Is G2211 on the board? It sure is. Supersize your visits. Is that qualify as one of the answers? If it's close. Great. Supersize your what? Visits? Honestly, I would say it's the number 2, Jen. Bill for the work you do. I feel like that's the same thing, right? Bill as much as you can for the work that you do, right? Supersize your visits. Nice. Chip gave the approval on that one. Oh, look, I understand. I listen. All right. Unfortunately, there are 3 more answers that you got to give me.
We say follow the no asshole rule.
Follow the no asshole rule. So fire someone? Honestly, give them number 5, Jen. Hire slowly, fire quickly. No assholes. Sorry, I guess maybe I shouldn't say that. Ooh. Danger. No, I'm allowed to do it because I'm fun and spicy. They let me do fun stuff. All right, so you got 2 more answers on the board. Come on, kidology, you got this. Kidology, the study of kids. if you go to the Latin root. And you've gotten 3 out of the 5 answers, which is very impressive, so. It's really quiet.
Adjust your prices properly.
Adjust your prices, raise your prices. Is that on the board, Jen? It sure is. The number 1 answer was raise your prices. All right. So you've got one more answer on the board.
How about, I don't know how to say it, but governed by your values.
Yeah, mission. Yeah, governing by your values, following your practice's mission. Is that on the board, Jen? It is not. Don't do that. Always leave them guessing. This is our mission? No. No, but we are going to give Eastern Pediatrics the chance to steal this. And if I've got this right, if you guys get this, you win. If you guys don't get it, the newbies over here take it. Yeah. Look, Yuisha, Sandra, I know you guys have heard Chip speak a million times. Yeah. Your recall, patient recall, yeah. Jen, is that for the win or for the loss? It's on the board. Patient recall. All right. Congrats to Eastern Pediatrics. I do have prizes for everyone, though. I don't know if you guys knew that you were getting prizes or not. But, Aaron, do you want to be my Vanna? No. We have an Animal Crossing set and a little car Lego City set for the participation. For the winners, we have the Pretty Pink Bouquet set. And we have the Love Statue set. Of course. And like I said, you guys don't have to worry about it too much because you got the participation prize. But you guys, I'm kidding. Take them out of the box and then squish them in your suitcase. Yeah, and then you're good. All right, well, thank you, everybody, so much. You guys can head back to your seats. Give them a round of applause, everyone. So I feel so silly wearing all this outfit because I have to introduce our next speaker, and boy, is it an incredible speaker. I heard her talk before at other conferences, and you're good. And I'm going to introduce the next speaker. Sorry, she's really great. So I have the honor of introducing our next speaker, who is an MD, MBA, FAAP, professor of pediatrics at the Keck School of Medicine, University in Southern California, and attending physician at the Children's Hospital in Los Angeles. I have to read this because it's just an unreal resume. This person's known for their work in integrating care for children with developmental disabilities and behavioral health conditions into primary pediatrics. As president of the American Academy of Pediatrics in 2018, she was best known for her advocacy for humane treatment of migrant children at the U.S.-Mexico border. Her explanation to the public regarding the harm to young children during the zero tolerance policy that included separation of children from their parents at the border to help mobilize advocates across the political spectrum to end this policy. She continues to advocate for basic human rights for children throughout the entire world. I have the honor of introducing Dr. Kraft.
Thank you so much. Yeah. And I love your shoes. Those are just amazing. I could never walk in them. But yeah, that would come right after trying to figure out the Wahova app. But but really great to be here, and so glad that I made it here. So I was at another conference in DC, and was supposed to fly up Wednesday night, and my flight was delayed, and then canceled, which I found out at 4 o'clock in the morning on Thursday. And so I was able to get onto Priceline and rent a car, and I'm going and get the car, find out I have the second to last car that's rented. And there was a couple behind me saying, we just missed our flight to Burlington. And they looked to be like about my age and like, kind of total Burlington hippies. And so I'm like, why don't you just drive up with me? Well, they were a hoot. So we had a great time driving up, 10 hours there. The guy's name is Moon. That's his first name. And they own Bertha Church, which is this lingerie shop downtown. So if you're ever around there to see... So his wife was answering questions from customers yes, we have nipple shields, and yes, we do. I mean, it was like the best car ride I could ever possibly have. It answered one question, no, we're not that kind of church. So it's, but you have to kind of take that attitude towards this time right now because it's so crazy and so surreal and so awful that we have to know what we know, do what we do as pediatricians, and really activate ourselves and our patients to take care of our families. So my disclosures. So we're going to recognize some of these new assaults on child health, review what organizations are doing to stand up for kids, and then commit to using available resources, including yourselves and your staff and your practice, to advocate for kids and to get families to advocate as well too. So it's a cluster. All kinds of, every other day we're hearing about measles outbreaks and what things are not going to be funded anymore and ACIP being fired. So I'm going to go through some of these things, not everything, but how do we break up the fire hose so that we can attack it from one place to another? So then there's this piece of whatever. This is written by AI. And I tell my patients this, have you ever just written something by AI? Guess what? The MAHA report was written by AI, and it has fake references in it. So there's nothing really to make out of this. And look at who one of the authors is. This didn't come up. It did in my original here, but Stephen Miller is one of the authors on here. Now, sadly, I actually have a kid the same age as Stephen Miller. That's horrendous. He's like 39, and I have a 39-year-old. I'm just appalled by that somebody my age could have a kid that age who is so awful and terrible. Somebody did not put him into timeout enough as a kid. But anyway, it has no business writing anything about child health. So we're going to talk a little bit about our domestic terrorism landscape, some of the changes to ACIP and immunizations. When are the cuts happening? A little bit about what is in the big, beautiful bill that actually may be a little bit helpful for some of our families, because I recognize that our families ride across the political spectrum. We have some families who are very conservative, and we got to take care of their kids too. And there may actually be some things that might be helpful for these families. So how do we point those out so that we continue to have that relationship with our families in practice? And then a little bit about our safety shortcuts and consequences and communication. So I'm going to talk about children and immigrant families. I live in Los Angeles, where we are seeing the most horrendous things happening right now. One of my nurses was picked up by ICE a couple of weeks ago. He is a U.S. citizen. He was born in the United States. He is, employed, a great guy, and he's brown. And he was taking his 9-year-old home from soccer practice one night, and a police car pulled up behind him, and he got out of the car, and they put handcuffs on him and arrested him and took him to a detention center. Left his 9-year-old in the car by himself. The 9-year-old had the presence of mind to see that his father had left his cell phone in there, and so he called 911 and he called his mother, and within 24 hours they got him out of the detention center. But OMG, I mean, this is not happening to immigrants. If anybody thinks that this is happening to people who are undocumented, here illegally, criminals, wrong. This is happening to brown people. And, when we see this, the Kaiser Family Foundation has talked about this, living in an undocumented immigrant family under the second Trump administration, fear and uncertainty, impacts on well-being. So a little bit about what are the different statuses of being legal, illegal here. Temporary protective status is what people have gotten where they've come in, they've claimed asylum, they've been adjudicated to be here legally, and they're initially given temporary protected status because that means they won't be deported and they can actually get some work. Asylum, claiming asylum because you came from a country where there was harm to you and your family, provides that permanent protection from persecution and that path to a green card. And then the green card grants permanent residency, so it allows individuals to live and work in the US permanently. And then from the green card, you can actually have a path to citizenship, which is the right to vote, to hold public office, access benefits, including Social Security and public education. And then there's DACA, the Deferred Action for Childhood Arrivals. These were youth who were brought to the US before age 16 and have resided in the US since 2007, and there have been protections for all of these people. Right now what's happening is temporary protective status is going away. I mean, even the Supreme Court is ruling that we can send people away who have been here because they came and they were fleeing violence, and you know, it's just really even terrible. We had one win in Los Angeles. We had a 4-year-old from Mexico who has short gut, and she's getting TPN, and she was going to be deported because she's from Mexico. We actually did get a temporary stay there. What is happening in Los Angeles is that there's lawsuit after lawsuit after lawsuit, and my nurse is actually suing as well too. But what that has now generated is a stay against anybody being able to pull you over without a warrant and a reason, because we have to stop just pulling over people because of their race or ethnicity. Well, where are our kids in immigrant families? And in LA, we have primarily Mexican, Central American immigrants, but we're having them from all over too. We are now seeing families fly over from Russia and then coming through the southern border in Mexico. And we've got them from all over the place here. Well, 47.1 immigrants live in the United States. 11 million are undocumented. But many have lawful status. So 1.2 million immigrants have, or they're eligible for that temporary protective status. More than 500,000 active DACA recipients, and then individuals with those pending asylum cases. And then for the kids, it's really important because 1 in 4 children in this country have an immigrant parent. And this is where I speak out here, is that it does not matter if we're looking at taking care of kids, 1 out of 4 have an immigrant parent. 12% are citizen children with non-citizen parents, and then 4.4 million US-born children who live with an undocumented immigrant parent. And generally what happens is that you have a family with people of all different statuses within that family, which is why in Los Angeles right now, our clinic visits are down 40% because people are afraid to come out. So it is something that we're standing up against. The whole idea of ending birthright citizenship is still in discussion, even though the Supreme Court ruled that lower judges can't overrule the president. It's happening anyway, and it needs to continue to happen. You know, if people are going to ignore what's right, then good people need to ignore what's wrong and just do it anyway. And that's where the pushback has come through. I mean, this is truly family separation 2.0, where the last time taking kids away from parents at the border was something that universally people saw that it was wrong. This is happening so insidiously and so terribly that we're not seeing due process. We are seeing US children being deported with their parents. There was one recent statistic that the largest category of people being deported right now are actually kids, and many of them are citizens. So a lot going on in through here. Arrests at sensitive locations. This is something that we're actually really working with in Los Angeles, because what happens is that you've got to really be looking at who's leading here. So Los Angeles, it's really started with the schools and with the healthcare clinics. So our LA superintendent had ICE come to visit him on April 7th, wanting to do a wellness check on the kids. And he said, no way, you're not coming in here. And the officials were all denied access into the schools in sensitive locations. And what LA has done is something that each of you can actually do. And that is to go on the LAUSD website. What they have are some great resources for our families who are immigrants. They have the Family Preparedness Plan, the resource guides, the red cards, school enrollment, placement, and centers, and then some of the wellness centers around and through here. So that it is publicly available. I'll go through a little bit of what is going on there. They go through when to exercise your rights. So when Immigration and Customs Enforcement comes to your home looking for somebody, when the police stop you for questioning, when there are ICE raids around there, you have rights, and you can stand up for these rights. And there has been pushback on these rights, but this is what is really important. And this is what we talk to our families about here. Red cards. Anybody have any red cards available in your office? We keep them printed. We've got lots that we continue to print. We print them out just on paper to give to people. We have people taking pictures of them. We have QR codes to having them there. But the red card is something that any immigrant family can give to an ICE agent that essentially says, I don't have to talk to you, you need to go away, you are not welcome here, and that I am not going to go with you, that if you are coming into my home, this is actually an assault. We have them in English and Spanish. We actually are putting them together in other languages as well, too. A number of our Asian families are also being picked up by ICE as well. And so we're beginning to start to look at getting these in Mandarin. And in Los Angeles, Korean is another big language that we're using to put these into. But having the red cards or having a QR code to the red cards, if you've got immigrants in your practice, really, really important. So it's something that they can even just hand to an ICE agent. And why is this? I think one of the areas of understanding that's really important is looking at judicial versus administrative warrants. So a judicial warrant is something that you have to follow. It is issued by a state or federal court judge. It authorizes searches, seizures, arrests. It is an actual warrant. It's signed by a judge or a magistrate. It specifies an address and time period for that execution, and it has to be complied with. It does authorize entry to private areas if valid, and that is because a judicial warrant has a reason for being put into place, that you've got a reason to want to have somebody search your house. What's happening is that if you're seeing warrants coming from ICE, these are administrative warrants, and they are issued by the Department of Homeland Security. They primarily authorize civil immigration arrests. They usually are signed by an immigration officer, and they usually mention the term alien. These are not real warrants. These are fake. They don't require compliance. They do not authorize entry into non-public areas. So if there is a warrant, it's important to know which type it is. One of the things that we have done with our clinics and our practices, and actually even some of our network practices are working on this, is getting staff together, getting that really uppity staff member who knows the difference here. Somebody who is usually going to be in your face, get them in charge of this. They are the ones that will meet an ICE agent at the door, give them a red card, tell them, let me see your warrant. Oh, this is an administrative warrant. You are not allowed in through here. And in many cases, we have security called. I mean, at the hospitals, this is a kind of a red flag for calling security right away. We have not seen them come to our office. There was a hospital in Ontario, which is just to the east of Los Angeles, where they did have ICE coming in to try to find a patient. But we have not seen that happen yet, but we're prepared in case it does. So much for our immigrant families and immigration. A lot happening there, but know that you have rights, know that your clinic has rights, know the difference between a judicial and an administrative warrant, and have the people there in place to be able to do this. Have red cards for your family. Let them know that they can be empowered by all of this here. So the next great thing is ACIP and immunizations. We knew this was going to happen. I mean, we knew if Robert F. Kennedy Jr. got to be HHS secretary that he was going to do awful things to vaccines, because that's who he is. So we have the dismissal of the ACIP members. The advisors were dismissed on June 9th. they were replaced with the signers of the Great Barrington Declaration, which I'll go to in a few minutes. And these were a lot of people who, in some cases, were vaccine researchers, and then they changed their position on vaccines, or they themselves refused vaccination. One of the folks who actually is a vaccinologist that we know of is Cody Meissner, who at one point was our chair on the section on infectious disease at the AAP. He was a signer of the Great Barrington Declaration. And of note, there were no Democrats, specifically no Democrats on ACIP right now, so they did bring something political into this. So what is the Great Barrington Declaration? This was something that was put into place in late 2020, just as COVID vaccinations were coming out. That essentially the bottom line is that we are being too restrictive, that we just need to let it rip. We need to let it kill people and decrease the population. We need to be, giving people healthy food and healthy places to be, but that we shouldn't be shutting down. And there's a lot of different opinion on how long we had things shut down, what happened with school, should kids who were younger be in masks, and that will probably continue to go on board. But much of this was really very anti-vaccination, where we knew that the vaccines were something that were very helpful and they were keeping people living in 2020, 2021. But the Great Barrington Declaration was really kind of the scientific community and some of the backlash to what was happening in terms of some of the COVID precautions and vaccinations. So there were a number of signatures on this, and all of the people on ACIP were really some of the authors of the Great Barrington Declaration, or people who really supported it. So what happened at this last year's ACIP meeting? The recommendations for COVID-19 vaccines for healthy kids and pregnant women, those recommendations were taken away. Something really very anti-science, and just as we have enough patients who don't want to give their kids a COVID-19 vaccine, but it should be available and paid for and covered by insurance for those who do want it. Pregnant women is another thing. I mean, the data is very clear that COVID was something that really killed pregnant women, and that they actually should be vaccinated there. So that was one thing. They did approve clesrovimab, which is kind of like Merck's version of nirsevimab, for RSV prophylaxis. So we'll have two things on the market. Competition's never a bad thing in my own mind for things like expensive monoclonal antibodies, and maybe we'll actually see a little bit of price decrease or some incentives for practices to get this in bulk or better prices with that. And then finally, this insidious plan to study hepatitis B, whether that should be given at birth or not. MMRV and the current childhood vaccine schedules, which is, of course, we all know that does not need to be studied. We have our own study going on right now with the greatest measles outbreak since the 1990s going on in the Midwest because of people not vaccinating, that it does not need to be studied. We don't need to have researchers looking into this. And the guy that he wanted to actually put in charge of the study was a discredited researcher, one of the Geyers, who was, 30 years ago, again, was telling us that thimerosal was bad. And, I remember when RFK's article on this came out in the Rolling Stone, back when the Rolling Stone was really a magazine. And I remember reading this and thinking, this is just awful then. And we had people trying to go to our state legislature to talk about putting money into a thimerosal study. And all you had to tell people then is that Robert F. Kennedy published in the Rolling Stone, and that's not a medical journal. And they were like, okay, that's great. That's a great way to be talking about this here. But I think we have to continue to remember that he's not a scientist. So there was a recent lawsuit actually led by the AAP, and I was very happy to see that they were at the head of this, suing RFK Jr. for the things that they were doing to the vaccine schedule. Because if we have vaccines that are being studied and they are not being recommended, that's going to travel down into, will insurances pay for them, and will we have access to them, and will companies make them? The whole idea that pediatricians are profiting off of vaccines is, of course, laughable to anybody in this audience. But this is something that we continue to actually have to say to people there. So the other groups that joined this lawsuit were the American College of Physicians, the American Public Health Association, the Society for Maternal Fetal Medicine, the Infectious Disease Society of America, and then the Massachusetts Public Health Alliance. So that lawsuit is going forward. It is something that I'm really glad to see our organizations standing up for us and for our kids, because it is really a pillar of prevention for all of us, and we need to have the big dogs in our rooms standing up for it. So what about the big ugly bill, and what happened in there? And again, what are some of the things that may actually be helpful for you to know to talk to your families? Because as I'm talking about strategy from here to the end of the talk, it's going to be about this. You have the relationship with your families. You are a trusted source of information for your families. Kids come from Republican and Democratic and other, all over the spectrum. What can we do to support our families? And then what can we do to get those families to be a voice for us when we know what's best to take care of kids and the government is just denying that and tearing it apart? So a couple of things to know. So your filers earning up to $500,000 a year can claim now up to the $40,000 in state and local tax deductions. So those of you with families who earn up to $500,000 a year, this is actually a good thing from the bill that you can talk to them about. And then the 2017 tax cuts become permanent. It is good to note that the maximum child tax credit will rise to $2,200 a year, with a refundable portion at $1,700 a year, and will be indexed for inflation. So we will begin to start to see the child tax credit rise. Not a lot, but it's something. Seniors, so some of your families where you have grandparents raising grandkids, we have a lot of that where I am. I know that when I was in southwestern Virginia, we had a ton of grandparents raising grandkids. There was actually a bonus deduction of $6,500 a year if they made $75,000 as a single person, or $150,000 as a married couple. That could go a long way for some of our grandparents. Really, really important. The auto loan deduction is really kind of laughable. So first of all, this is for individuals earning up to $100,000 a year or $200,000 a year that are married. They can deduct up to $10,000 of interest expense on a new vehicle made in the United States. Now, if you figure this out, my daughter and I have been car shopping. She needs a new car. If you figure this out, you have to get like one of these jumbo huge trucks that are $100,000 to make this work. You know, it's not going to happen if you need like a Toyota Corolla or something that's going on there. So this sounds good. There's a lot of fake to it. The other two things that sound good and there's a lot of fake to it are this: no taxes on tips. People were raving about no taxes on tips. This is up to $25,000. Those of you who can live on $25,000 a year, go for it. No taxes on overtime. This is up to $12,500 a year. Those of you who can live on that, that's amazing. So these are breadcrumbs. And they were really lauded as we're doing this for working people while they're taking their Medicaid away and taking other services away. But these are things that you need to know, because you might have a family that may be a single grandmother who's taking care of kids. And if you let them know about this, there may be something they may be able to take advantage of, and it'll be helpful for them. And again, it's nonpartisan. It is what it is, and it's good to know about it. Some of the tax credit eliminations are not so good. So for electric vehicles, this is ending in September of this year. You were getting a $7,500 for a new electric vehicle and $4,000 for a used. That is going away after September 30th. And then energy efficient home improvement benefits was up to $3,200 a year, and that's ending at the end of this year, because we wouldn't want to have anything energy efficient around here in this country now. Medicaid work requirements. So important to know when this is going to happen, because you may have parents asking you about this. When do these go into effect? What does it mean for me? So the idea is that Medicaid recipients between the ages of 19 and 64 will need to work 80 hours a month, so part-time, to be eligible for benefits. How that is going to be tracked, I have no idea. I know states that have tried to track this before. It's been more bother than it's worth to do it. But it is effective December 31st of 2026. So again, it's not going to be effective until after the midterms. And that is, of course, put in there for a reason. So something to talk about, but it is something that the midterms will happen and then people are going to have to start working. So it's good to know that. It's good to mention to your folks here. What are some of the exemptions? So certain medical diagnoses for the adults will be an exemption. And then dependent children under 14 years will be an exemption. This is problematic because what if you've got a 15-year-old who has intellectual disability or is somebody that has to be cared for and you're getting Medicaid and you're taking care of them? That's not well spelled out. And then the other thing that's problematic is it's going to require a 6-month beneficiary review. That is a huge pain. Right now, the annual review is problematic, and you know those, your billing people know this. So if you accept families with Medicaid and you've got a child that has to re-up every year, you'll find that they may come in and they may not have their insurance because something in the process didn't happen right. Well, this is going to be every 6 months. Makes that so much harder to actually keep insurance and be able to use it. SNAP eligibility. So again, this is beneficiaries 18 to 64 will have to work 80 hours a month to receive SNAP benefits. And the same exemptions will be for certain medical conditions or dependent children 14 or under. They need to be U.S. citizens. Now, how is that going to be actually documented? And that's going to be problematic. And it's not clear when this goes into effect. So the Medicaid work requirements go into effect at the end of 2026. Not sure when that SNAP eligibility benefits go in. So a lot of confusion about this, and something that you can tell your families with authority that you don't know when this is going to happen. With the Medicaid work benefits, you could. So there's something called the Trump account for child savings, and this was actually touted too as a great way to save for your child. So let me tell you what this is. This is a tax-advantaged investment account for kids born between January 1st of 2025 and 2028. And in this account, the government will put $1,000 into it, and parents can contribute up to $5,000 in post-tax dollars. There's not even a pre-tax benefit to this. So this is like if you got an extra $5,000 sitting around that you're not spending on your child, you can put them into this fund. Money grows tax-free. Beneficiaries can access funds at age 18. You can withdraw funds for education, disability, and natural disaster-related costs. So you can use your child's account to pay for your natural disaster when that happens in your area. And again, you know, maybe the federal government's not going to do it. If you save it in a Trump account, then you can pay for it tax-free. Beneficiaries will be able to withdraw $10,000 for a new home or $5,000 when they have a child. So this whole thing about the government is going to give you $5,000 to have a baby, this is how the government is going to give you $5,000 to have a baby. It is ridiculous, and I think that you just have to market this to your families as that if your child is born, they can get $1,000 in an account. Everything else, you're giving money post-tax. You can only withdraw it for certain things. There may be a provision that you can withdraw this for natural disaster relief because the government doesn't want to help you out with that anymore. And the $5,000 for having a child will go to your child when they withdraw this. So it's a scam. Federal student loans. This is something that, you know, I was having a daughter starting medical school. We're looking at this, and fortunately it does not go into place until July of 2026, so she's good for this year. But it is limiting $20,500 a year to borrow for graduate school or $50,000 for professional school. You know, what that is going to do is that's going to keep a lot of people who can't afford to go to medical school from going to medical school. And you think about the sustainability of our profession and who's going to be working at our profession. I look at my residents right now. I have residents who are just wonderfully diverse. I have 116 residents They speak 40 languages between them. It's really cool. I'll go into preceptor resident or do a direct observation, and I'll have a resident speaking Arabic to an Arabic-speaking family, or Thai, or Mandarin, or Armenian. And I look at that and I'm like, they're getting along just fine. I'm not sure what's going on by observing, but that's our future in this country. And if we can't get people who come from low-income families to be able to go to medical school, that's really not going to be very helpful for our profession. The lifetime limit in here is $100,000 for graduate school or $200,000 for professional school. I can tell you most of my residents have borrowed way more than $200,000 in order to go to medical school, so worrisome. Parent Plus loans are going to be limited to $20,000 a year with a lifetime of $65,000 a year per student, so the parents can't even borrow with that there. There will be Pell Grants for short-term vocational programs, which is really good for people who want to do short-term vocational programs. But what's problematic is that there's really going to be the emphasis on vocational programs and de-emphasis on developing professionals and some of the brain trust of our country. So some of the other cuts that are going on here, certainly funding for services, immunizations. We've had 2 states cut fluoride out of their water. Good luck with your teeth. SNAP and food programs, foster care and juvenile justice, Head Start, Title I, special education. What's going to happen is you're going to hear about this from your patients. You're going to see it. And what will happen naturally is that your patients are going to come to you and say, my child can't go to preschool, so I can't work, and I don't know what I'm going to do about this. And you're going to hear about it. And what we have to do is to start to get our patients activated. And I recall doing this back 20, 30 years ago. In Virginia, Medicaid was really cut down to where we as practices had to limit the number of kids we could see who had Medicaid because we just couldn't afford to accept the payments for it. And we lost money on every patient that we took care of. And so we got our patients activated. So we got the same person who was that uppity staff member that you're going to put in charge of greeting ICE at your door. We decided that what we would do is we would pull up the legislators' names and numbers for where families were from. And we would have to tell these babies that we saw in the hospital, tell their parents that, come for one follow-up visit. Here's a list of people who still take Medicaid. Unfortunately, we can't do that anymore. And do you want to complain to somebody about it? Come in with a staff member who is going to figure out your address. Here's the name of your local legislators, your senator and your delegate. Here's the name of your state congressman and your senators. And you're going to make some phone calls. And they did, and they started with the local legislators. And why is that? If you complain to a local legislator's office, 5 complaints is a crisis. It's way more effective than doing it with a congressional member of Congress or a senator. Do your local legislators first. And they would pick up the phone and they would say, who is going to take care of my baby? Tell me who's going to take care of my baby. And what happened because of that is that in Virginia, we got the legislators together and they demanded that Medicaid rates be raised for OBs and pediatrics. And that was something that has continued to happen because we've had the families where we see the cuts and we as pediatricians feel so dedicated. Get those families involved. You just have to organize it. Have a place in your office where they can call, have the phone numbers there and available, and ask them, who is going to send my baby to Head Start? Where is my baby going to go for preschool? Who's going to educate my child? And what is going to happen is that it's going to start at the local level. People are going to hear from their constituents, but people are going to hear in your congressional district and with your senators as well too. And that becomes a movement. That becomes something that your patients can do to advocate for these practices to actually change, because that's the only way it's going to happen. The protests are great, but when they're targeted at your local leaders, they're way more effective. So something that you need to go ahead and do. There are ways that we are making this speak out with the AAP. So the AAP has their advocacy snapshot. If you go to federaladvocacy@aap.org, you can sign up for these. And what will happen is that you go on there and you can look to see what bills are in Congress, what are some of the bills going through the Senate, what is it that you can actually send a letter to? And they've got the letter all written out there with your support or your non-support for a particular vote. And you can click on it and send that right away. It takes you 2 minutes to do. It's really, really easy, but it's a way for you to know what's going on in Congress and then to send your opinion to your senators and your congressmen and to be able to do that within 2 minutes, because none of us really have time to do a lot of those things. But for families, know what those resources are. Have those resources together when you are meeting with them. Know the good things. I mean, you might have a family that wants to buy a big truck because they like big trucks, and they might be able to get some interest taken off of that because, it's okay to let them know what's going on there. Having your grandparents be able to get an extra $6,500 a year off of their taxes because they're taking care of these kids and because of this bill, great. Tell them all about that. But let them know, too, that if they're seeing drops in their services, there is something they can do about it, and here is the phone number, and go ahead and call. Have those phone numbers. You could have them on websites and things. I tend to just like to have them in the office or a QR code or somewhere when that family is feeling down, they can act on it right away. Because if you send them home with it, they're not going to do it. But if they do it right there, it's going to get done. And I think that we just have to continue to remember during this time that the arc of the moral universe is long, but it bends towards justice. If you think about gradualism versus punctated equilibrium in health policy, if you think about it, we, throughout time, eventually got Medicare and Medicaid. We got our Social Security amendments. We got our piecemeal expansions of the 1980s. But things didn't happen for a while, and all of a sudden, in 1965, there was enough groundswell to get Medicare and Medicaid. And then we got into the Reagan years and, discussing our patients in not very great, really in terrible sorts of adjectives, and looking at how we were supporting people who were ultra rich. But out of that, we got into the 90s, and eventually we had the Balanced Budget Act, which started CHIP, the S-CHIP program, 1997. And then we went from this to some of the abuses that we've had from our health insurance agencies and people not having insurance and being bankrupted because of that. In 2010, we had the Affordable Care Act. So we're in that climb right now. We're in that place where we are seeing something that we've had that has been built and has been awesome being shut down and torn apart. And we're not letting that happen. We're continuing to have that relationship with our patients. We are continuing to show our patients what they can do with some of the rules and regulations going on there, and we're continuing to encourage our patients to speak out and call the people responsible if something is happening that is going to hurt them or hurt their children. Because as pediatricians, we never stand down, we never give in, and we never give up. Thank you.
Give it up one more time for Dr. Kraft. Thank you so much. Yeah, we do have a couple minutes for questions if folks have questions for Dr. Kraft. And then I will release you guys for break at 10. So we've got about 10 minutes. If anybody has any questions, you can raise your hand and I'll come over with a mic. Unless, I
want to see him running those boots.
Here we go.
Hi, Dr. Kraft. Always a pleasure to hear you speak. I got a text yesterday from the person covering from me. What do I do if ICE shows up? And so it was a very cryptic. I made sure they were okay. They were. Were they in the area? She wasn't aware, but she wanted to have a plan. And so, so we quickly kind of, we're a private practice. They are not allowed in the office. We will lock the door and we'll start checking people at the door. And unless I see a federal judge sign it, they cannot come in without a warrant. So, so that's my plan. I just want to make sure we're on the right track for that, or if any suggestions you would have for how we should approach this situation.
I would say that exactly that. Have the red cards printed. Because what happens is when they show up, and they're very intimidating. I mean, in LA, they're wearing the masks and all that other garbage, and have the card that they just give them. Because when they show up, your staff gets scared. If they've got just something they can give them and say no, that's helpful. So also, if you have security in your building or around in the area, if you do not, this is a speed dial to 911. To get your local police in there too, that this is your staff should be empowered to be able to do that.
Hi,
Yeah.
Dr. Kraft. Just to add that, we ordered the red cards and we leave them in the bathrooms in our practices so that people can take them without having to ask for it, et cetera. So I have a question about the Medicaid cuts. And I'm thinking of this in terms of how to talk about it with people who may support the Medicaid cuts. And so, you know, the cuts target folks who are older, who need to prove that they're working. And so we all acknowledge as pediatricians that when parents lose Medicaid, it affects the children. But what else can we say when we talk about Medicaid cuts? And I think my question is the 14, 15-year-old exemptions and how, you know, does that mean that people over 15 have to prove work requirements, or is it parents who have dependent children under 15?
So great question. So the first question is about the Medicaid cuts themselves. How do we socialize this with our families? What happens is there's a cascade. So many hospitals and so many services that have to accept Medicaid have to have enough rate that they can stay open. If Medicaid goes away, a lot of these services go away and some of these hospitals go away. And if you live and work in a rural community, it's really important, because even if you have private insurance, means nothing if you have no one to go to. We're seeing that now with maternity care. So we have so many families who come to us from Arizona, where there's some abortion bans, or some of the other states. Texas will fly over to California because they're just not getting the maternity care because the OBs have moved out. They're not going to put up with that. So talk to it about services. If Medicaid is cut and Medicaid goes away, that's a chain reaction. Your hospitals go away, a lot of your providers go away, and even if you've got private insurance, you're not going to have anyone to go to. So number one. Secondly, the SNAP benefits. So SNAP and Medicaid, this is for the parents of kids who are 14 and under. So if you're a child up to 18, it doesn't affect you in terms of SNAP and in terms of Medicaid work requirements. But if you're over 18, you have to have kids who are 14 or under to be exempt from the work requirements.
This is a very lowbrow question, but how do you know if it's a federal or administrative warrant when they're showing it to you?
The best way to know if it's a judicial or an administrative warrant is to see who signed it, number one, because usually it's going to be, the administrative warrants are by and large going to be DHS officials. The second thing is look to see if there's a mention of alien in there. If that word is in there, it's an administrative warrant, and you do not need to comply with it. The word of alien, because they often will say something about aliens in there, and I don't know about people coming from Mars and stuff, but it's a...
Any other questions for Dr. Kraft right now? Yeah.
In your practice, we're in Texas and we're experiencing similar situations of fearful parents. Can you give us some suggestions of how to communicate that our place is safe for them?
Really great question. How do you communicate that you're a safe place? Well, we say it, we have it all over the place. One of the things we've been doing, we've started doing well checks. We've been doing the cognitive component via telehealth. So we're turning them into telehealth appointments. It's just like COVID. And then figuring out who's a safe person who can bring your child in for their, weight measurement, physical exam, and immunizations. So we're beginning to do that. There's discussion of home visits. There's a lot of fear about doing that because you don't want to be singling out different places where people can come in the community. So a lot of discussion, but right now we're flexing a lot to telehealth for well visits even, and then figuring out how we get these kids in for some of the parts of the physical exam that you have to do.
All right, sweet. I'm going to wrap it up there. Thank you so much, Dr.
You're welcome.
Kraft.
Thanks for everything you do.
Yeah. Thank you. And honestly, this is why I love PCCers, right? Because the first questions asked were, how can I help prepare my families to feel protected? And how can I make sure families know that my space is a safe space for them? That's amazing. This is why we love working with you guys. So everybody, we're going to take a little break, and then morning sessions are going to start at 10:15. I was told to let y'all know that if at some point in the day you want to return your lanyard to a box at the check-in desk, we will reuse them. So you can take your name tag if you want as a keepsake, but we will definitely reuse the lanyards. So thanks, everybody.